Our first bio is for Michelle Atanas. Okay, I was practicing that last name pronunciation there. Michelle is the operations manager for Clayman Urology here in town. Michelle and her staff at Clayman Urology are dedicated to their patients, providing unmatched service by delivering quality care in a very personal atmosphere. She has been in urology for the past 12 years and in healthcare for 16. Her strengths are in strategic planning, improving efficiencies of operation, and team building. She has a bachelor's degree in business management from the University of Central Florida and is currently pursuing a master's degree in health management. And when away from her second home at the office, she enjoys spending time with her family. Jorge Cruz is filling in, and he is the president of Marketing Innovations Group. He helps doctors' offices raise their online reputation by helping educating the staff, providing strategy and the tools to acquire great feedback and then spread that good reputation online. He's been involved in marketing, in all manners of marketing, traditional first, for the last 15 years, and 5 of those, the past 5 have been in online marketing. Next, we have Corey Gerald. He is co-founder and head writer for Doctor Marketing Tips, a website designed to help medical marketing professionals market their practice better. He has extensive medical marketing experience and has been working with clients every day to grow their practice since 2007. Corey has an extensive background in the fields of online reputation management, inbound marketing, content creation, social media, advertising, copywriting, public relations, and website programming. He graduated from UCF in 2008 with a bachelor's degree in advertising and PR. And away from the office, Corey enjoys innovative marketing, chocolate chip cookies, and rooting for the Orlando Magic.
First of all, good morning to everyone again, and I certainly want to thank MOROF for inviting me here today. And I'm excited to be here and to discuss a topic that is certainly growing momentum in healthcare, and that's certainly patient experience. With a show of hands, do we have any provider offices, facilities here with us this morning? Great. Well, hopefully in your office, customer service and patient experience is one of those things that it's continuously being monitored and evaluated and adjusted when need be. It's certainly something you don't want to sleep on. And everyone else that does not work in a doctor's office, we're patients ourselves. And so each and every time we walk away from a doctor's office, we've gained an experience. And hopefully these are positive experiences. And sometimes there are a few bad experiences in there. But as a result of these experiences, there are trickle effects. Whether it be a positive experience would warrant you to continue to seek treatment from that provider, perhaps refer a family, a friend, a coworker to that provider if they're not happy with their current one or seeking another provider. Or perhaps on the other spectrum, a bad experience would warrant you not to continue, not to complete treatment with that provider and seek treatment elsewhere. So to illustrate how important customer experience is, I'll share with you one of my own experiences. And as I do so, I ask that you think about your own experiences, whether it be ones that you had personally or when you attended an appointment with someone else, and what was the effect, what was the outcome that resulted from that experience. I attended an appointment with my mother who was 4 weeks post a total knee replacement surgery. And she was referred to a specialist by her primary care physician, and we got this reference from a friend. We pulled up to the building. It was a beautiful building. The entrance was grand, and the office suite was beautiful. I had all my paperwork for my mother, the new patient packet. I had her last office notes from the primary care physician. I had her lab work. I even had her photo ID and insurance card and her copayment. I presented that information to the receptionist. She kindly took the paperwork, and she had said to have a seat, and she'll be with me once she finishes the process of checking in my mother. Shortly thereafter, she returned the cards back to me, and as I proceeded to sit down, she proceeded to go to the back. Now, this wasn't a tiny office, but it was a fairly small office, and they had wood flooring, so sound travels. And so they're in the back talking about this weekend and her new bow and this 2-piece bathing suit that she was going to wear for the weekend at the beach. And so in the front office was this TV that had the same video playing every 3 or 4 minutes or so. And at the end, it was a pause for a few minutes before it rewound and restarted again. So how many times can you listen to the same video over and over again before you focus your attention on something else? And so I was living vicariously through this two-piece bathing suit that she was about to wear for the weekend. So we were in the waiting room for about 15 or 20 minutes before we were taken to like a central hub where they went over her vitals and her medications, and then we were taken to another room. But this wasn't the patient exam room. That was obvious to us as soon as we walked in because it was this large room with recliner chairs and IV poles. The light was very dim. There was no TV, no magazine, no music, and just me and Mom. And although I love having conversations with Mom, when you're waiting, waiting for an appointment, especially in a new place, you're profoundly aware of every second that goes by. And so luckily we weren't in there for about another 10 minutes before we went into the patient exam room. And the doctor came in shortly thereafter, introduced himself, and asked Mom what brings her to the office today, as most providers do. And so as he enters, he sits down in front of this desktop that's in the room, and his back is towards us. And he's on this, the EMR system obviously was not specific to that specialty because he was doing tons of copying and pasting and deleting, and it was Microsoft based, so he was typing away. I'm not sure what he was typing because he wasn't really asking many questions. He would periodically go through the paperwork that we provided, and I assumed that he was putting in labs, but he obviously wasn't retyping the whole primary care physician into his notes. So he eventually got to the assessment part, and he was going to check her extremities, and then he goes down to her knee, and he jerks her knee. Mom jerks, and I didn't even realize it, but I go, ouch! And my pain level went from 0 to 10, and I wasn't even the patient, nor did I have a knee replacement surgery. But I knew what she had experienced. And so his response was, oh, do you have knee pain? So I said, well, yes, it's in your documents. I just put it, in her documents, your new patient packet, that she just recently had a knee replacement surgery. So he says, oh, how's that recovering? And proceeds to the next knee and does the same thing. Well, she needs another knee replacement surgery on the other one. And so he turns around and he returns back to the computer, which tend to be his. It almost seems as though that was the patient instead of the human being standing behind him. And so that allowed me and Mom time to exchange these looks like we are never coming back here again. And so the visit ended with him ordering additional labs and a return visit in 1 month. And so upon checking out, the nurse brings up her schedule, and I said, I'll give you a call back, because I knew then I was not going to return. Not only did she not return, she went back to her primary care physician. She provided him feedback. He doesn't too want to continue to refer patients to a provider where patients are dissatisfied, right? And certainly those family and friends that have been her support group during this knee surgery would call and ask, how's it going? How was your visits? And she also then felt inclined to share that same experience with those providers as well. So it's certainly a trickle effect. And certainly that's a negative experience, but this also happens with positive experiences too that we share with other providers. So why is patient experience so important? Why is it a major part of healthcare? Well, for the obvious reasons, the patients are not going to return to a group that they do not experience great customer service or great patient experience. That's the obvious. But also providers need to understand that, one, patients have a choice. Every patient that walks through that door has a choice, on whether to come to that office. But they chose to come there. And we also need to be aware that our patients are customers. And certainly, like any industry, practices need patience in order to grow. And so we have to have an awareness that we need to maintain our patient base, certainly as competition grows, maintain our current patient base, as well as attract new patients in the office, whether it be by provider referrals, whether it be by current patients or previous patients, or marketing techniques. But we certainly can't provide that if we cannot provide great customer service and a great patient experience. More so than ever in healthcare, patients are more proactive than ever, and patients are demanding a lot more. They're demanding great customer service, and they're also demanding a great patient experience. Not to mention that patient experience are one of those measures that are going to be tied into our reimbursements and incentives with insurance companies, whether we continue to be participating providers on insurance plans. So there's consequences to not doing that. There's consequences to not being aware of patient experiences. But also more so, patients find it easier to qualify the customer service and the experience that they receive, and they're able to quantify. Now think about it this way. When you have an ailment or a condition or a concern, you go to a doctor. You don't know what tests or procedures you need to write. You seek that from a medical professional. So you don't have that body of knowledge to determine that. But what you can do, you do know that the experience that you receive from staff, the patient flow, the experience that you have even from the first encounter, you're able to make a determination on the quality of care that you received. And doing otherwise is detrimental and consequential to the practice. So there's results of bad experiences from providers' offices. One, patients don't return. That's a problem because not only does that patient not return, that patient most likely have shared that experience with other patients. Not to mention when patients don't go back to the office, they're not compliant. They're not continuing care. So the quality of care of that patient decreases. Not to mention if it's a chronic condition, the outcome of that patient, it could be detrimental, or it could definitely lower the chances of a good outcome because that condition was not treated quickly enough. And not to mention a bad reputation. And as I mentioned earlier, poor ratings from insurance carriers. Cigna just did this as well, is that they're taking patient satisfaction surveys. And that is a measure one of the measures that they're utilizing to determine providers if they're going to stay on their list. CMS has also put out an HCAP, and one of the measures in there is also patient experience. And some of the patient experience accounts for about 30% of the incentive reimbursement rates. So as I mentioned, it doesn't just stop there. It didn't just stop there when mom left that office. She shared that with other individuals. So on average, one dissatisfied patient will tell 25 others. And this is also true for positive experiences too, like I'd mentioned. And for every one patient who complains, there's 20 others that may not. Some patients are not confrontational. They're not going to express their dissatisfaction with the office. They just may choose not to return. And that's consequential. And it's obviously more costly to attract new patients than it is to just keep your patients happy by providing them great customer service. And it certainly doesn't just stop with just the providers, because it's not just the providers alone. It's everyone that's involved in the office, from front staff, medical assistants, everyone is involved. And there's other factors that take into play with patients evaluating the level of customer service, whether it's positive or negative. And that's wait time, as Dorothy had mentioned earlier. Patients' time is valuable, just as well as the providers. And so patients take time out of their busy day to come into the appointment and wait. And sometimes just letting patients know the provider's running a little bit behind, or just giving them an update, will help that situation sometimes. Billing issues. If patients are not provided the appropriate amount of adjustments, or patients being charged services that they should not have been. Also, rescheduling is an issue. And not just rescheduling, but also availability of appointments. Can the patient get in when they need to get in? If it's an urgent matter, does the patient need to wait 2 and 3 weeks? That also is going to be an issue for the patient that may prompt them to seek treatment elsewhere. And the length of time of responding. Obviously 24, 48 hours is a reasonable response time, but anything outside of that window would be problematic. And certainly prescriptions not being called in. I was just in the doctor's office with that provider. He said to take this prescription, and I just waited in the office 15, 20 minutes. My appointment time was about 30 minutes, and I have to wait at the pharmacy because you didn't call it in. That's also a problem for patients as well. And office notes. Patients have access to patient portals. Like I said, patients are proactive. They're reading those notes, so they need to be correct. They need to be accurate. And also, one of my pet peeves is an unclean and disorganized office. I already make a determination based on the office based upon the mess that I see in the office. And so that needs to be kept clean and organized, and the facility needs to be clean and organized because patients too use that as a factor. So what are some of our strategies? First, we need to identify patient experience as one of our major priorities on top of great customer service. And great patient experience is important to patients, and it's also important to your bottom line. Not just patients coming back to the office, but attracting new patients as well as our reimbursement rates. You should identify the patient's needs and issues and address them. Certainly, if there's a concern, take that and learn from it. Even positive experiences, we can learn from it. What took place? What could we have done better? What can we do to prevent it from happening again? And are there gaps and consistencies? And certainly as patient volume increases, sometimes we get so busy that we are kind of lax in some of the processes that we do, and we need to make sure that we are providing accurate. Patients want to be seen fast, but they want care to be done appropriately and accurately. And so we need to make sure that we're consistent on the services and our processes that we do. And are there things that frustrate your patients? This certainly can be done by patient surveys and just being observant. If there's new changes to the office, periodic surveys to see how patients are doing, how employees are doing, employee recommendations, what they're seeing, because they're also going to be able to provide you some valuable insight because they're at the forefront of in interacting with the patients. So they may also have a fit for you as well. And the last but not least is recruitment. It actually starts from there. We need to make sure that we have employees, staff in place that not only have the skill set, but also share the same values. Certainly as we transition from a volume-based to a value-based system where the focus was always on what providers or what services providers render, now to what patients need. It's important that we have factors in place and we have systems in place and we have people in place that can provide things such as great quality care and great customer service and patient experience.
First, of the objectives of this presentation, or the objectives of um, a good customer service, we need to learn to identify and analyze customer needs and problems. So basically, we need to the first thing we need to find is what is really what they need, what is really the problem that they are coming, and not us interrupting the patient and trying to just say our procedure or whatever. We need to first try to listen and pay attention to why they are coming to us, why they need us. Okay. Second, recognize the most common reasons for customer complaints. So we never know. Maybe they have a problem inside the our practice, and we need to find out. Like Michelle was mentioning right now, it is the waiting time. That is the way somebody treat them. That is the time they wait for a phone call back or something. So we need to find out what we're doing, if we're doing everything right, or if we're missing something, what we need to do. We need to discover techniques to cultivate and maintain patients' customer relationship. So we need to, as I said, we need to cultivate a culture on the staff of how we're doing our customer service, how we are treating our patients. Does we as a team are focused on doing the best, or does we are putting all the efforts in the top of the doctor, or if all of us as a team members we are paying attention to this matter. We need to initialize ideas campaigns. We need to be proactive on scheduling and doing some strategies and ideas on what things we can do, let's say this month, to be better. Next month we need to have a different plan. We need to be like every time trying to figure out different ideas and things to bring to the patients the best customer service as possible. We need to implement service standards. For example, at Candor, they are a dental spa, so while they have something implemented already that when they are doing your they're doing your dental work. They also are doing some massage for you at the same time. So they have built some standards in the process of the customer service to be basically looking to be different and do different service. We need to discover current service trends. So we need to be looking at what things we can do, innovate on our service to do always something different, something new that it's with the trends. We need to create reward system. Basically, we need to make sure that those happy patients they help us spread the word. So we want to somehow reward them for them to help us uh, spread our good message of what we're doing. We need to teach quality service skills because some employees they might be excellent on their work, on their expertise, but maybe they are not good at the customer service. They need some help on that. So we need to help them practice and improve their skills on this. And finally, we need to select service driven employees. Basically, we need to make sure, as I mentioned before, when we are acquiring new staff, that we don't only are going to evaluate them on how good they are on their expertise. We also need to see how is their attitude, because the attitude is more important than anything right now. We need to make sure that maybe they know what they're doing for sure, but mostly they are people that care with people, and they take time to listen, and they have the attitude of helping others. Basics of customer service. The first impression matters. It's that's we have only 3 seconds to make a good impression. So basically, we need to make sure that that first moment of connection with the patient it's super. We have the emotion, we have the caring, we have the like Michelle was mentioning, our practice. Everything looks organized, clean. Courtesy counts. Of course, it's very important how we pamper our patients. Okay, and attitude is everything. Like I mentioned before, attitude it's extremely important because they're going to feel and see everything from far away. How we um, start our conversation with them. Even the main most important thing is when the first moment of on the phone call. Once a patient is giving it the first phone call to the office, we need to make sure we reflect the smile on our we're saying we are happy to listen to them doing the right things, ethical issues. So um, we need to show them in every step that we do that we're honest, and we do everything online. Everything is it's we do things the proper way all the time. Effective communication. The customer service is effective communication. So we need to double our efforts on following how we follow up with patients, and this communication in our staff inside it's connected with every patient. So every when a patient is coming to our office, to our practice, that we make sure that we are not doubling efforts, and all of us we know what problem this patient has, so he don't need to repeat and repeat and repeat to every person in the office what they need. And in the example of Michelle, the doctor was not even reading the documents. So I mean, he's the main person that needs to be knowing everything that is happening with this patient, saying what you mean and meaning what you said. If you promise a patient that he's going to receive some document, some appointment on this date at this time, that we keep our word. We need to make sure that they don't waste their time. What you don't say, nonverbal communication. Basically, this is about the our body language. So if we are saying, we hope we have a wonderful day, and how we say it, so it's like I hope you have a wonderful day. So it depends on your. It shows more your body language, your eyes, how you care about what you're saying. You really are saying what you mean. Okay, putting words in a grammar usage. Basically, we need to keep our professionalism on what we're saying. So it's not like, hey, what's up, dear patient, good morning. We need to keep that part. We need to keep the professionalism on what we're saying. Asking the correct questions and answering the questions correctly. So if we make sure to listen to them and we take the time to understand their point and their problems, we will be able to give them the best answers. We need to basically establish a good connection with the patient. We need to make sure that we connect with them, that we interact with them, and we just don't see them as another number or something. We make that personal approach. We need to show them how we care and that we really are connected with their problem. And of course, we need to always keep our positively in our interaction. So maybe they come in a sad situation, maybe crying or something, and we need to just we should be like, we will help you. Be relaxed. Don't worry. It's not like, hey, you have a big problem. I don't know what we're gonna do with you. So we cannot put more pressure under them. We need to, on the other side, they have a problem. We need to make everything positive for them and having them a good expectation of what we're gonna get. Of course, we need to always keep our patients feel, very um, important. They feel important for us, and we need to handle different type of patient customers. Michelle was mentioning, you never know how they're coming, what problems they coming from outside. They have any issue, so and we cannot point at them of this is a bad customer, this is a bad patient. They might be very good, but they just have problems, and we need to help them in that situation. Of course, everything starts from the how we make this interaction from the beginning to the end. So once they come or once they call, how we treat them, which is our attitude with them, and finally how when they go, how we take, how was your experience, how was everything, and so they see that we care. In the phone call, this is something that we need to be very careful from the beginning, because this might be the decision for them, the factor for them to come or just not come, just for that way that we handle the phone call. So we need to listen to them. They need to feel that we're smiling, that we are happy to help them, and we need to avoid at all times to have a patient that is not happy. That's something right now that is extremely important, because it is not only affect us as the internal office, but also of me, like Michelle was mentioning, how they're going to go outside and mention to other family members, and if they go online, it's worse for you. Okay, and finally, we need to always be careful on how we're dealing with difficult patients. So how we relax them is not it's not about the customer is not always right. It's something that we know. Even when we know they might not be right, we need to find the way of making them happy and find a way of understand their point of view. We need to determine the reason of the problem. So if we know exactly what they need, we will be able. If we listen and we know what they need, we will be able to help them, and our the team will do it. So basically, we need to know what caused the problem. We need to, of course, rectify the problem. It's something very important that we always be able to say we apologize when we do something wrong. So if we make some mistake, we need to just say we're sorry, we apologize, and patients they will be glad to hear that we're humans and that we understand them. Closing this PowerPoint, basically we need to be consistent, being ready all time. We need to train our staff. It's not something only about the doctor. It's something that all as a staff members we need to pay attention to this, and always remember to be the best you can be every day, and always try your best.
Good morning, everybody. we've already talked about some of the ways that you can kind of grow and maintain your patient base, actually, in the office and face-to-face customer service. But a big part of what we see today on the medical marketing side anyway is the online factor. And so how many of you guys have claimed your online profiles? Vitals, health grades, couple of hands, that's about right. So if you haven't, not while I'm talking, but later today, go ahead and Google your practice and see what comes up, because odds are you'll see on that front page of Google there's little stars that come up with some of the sites, such as Yelp, Health Grades, Vitals. And I mean, I don't know about you, but if I'm a patient and if I Google practice or a physician and I see that there's only 1.5 stars, I'm not going to that guy. And it doesn't matter if that doctor is great and he has a wonderful bedside manner, but if my only impression is that star, I'm not going to go there. So what I want to talk about today is some of the things that we can do online and give you guys some action items you can take back to your practices and kind of work through without creating a lot of work for yourself. So Warren Buffett said that it takes 20 years to build a reputation and 5 minutes to ruin it. I would say that today, with the rise of self-referrals and online reputation management, it takes just a couple of seconds to ruin it. So nearly 75% of searches online are for small businesses and medical practices. And the fact is that searching for healthcare is the third most common activity on the internet behind email and just general search. And then it's healthcare right there. So people are looking. And patients have 24/7 access to your practice. Generally, we say that the first page of Google is kind of the gateway to that. So if you make it past that gateway, then your website is basically your online brochure, and so that's what patients are judging you on, and that's when they're deciding if they know and like and trust your practice. And as we all know, you do business with people you know and like and trust. So in the electronic age, patients can say and share whatever they want. And we often say that one of the great things about social media is it gives everybody a voice. And one of the terrible things is it gives everybody a voice. So telling your story is really the best way to create a positive reputation online. And some of the ways that you can do that is actually turn your patients into online advocates. So I'm going to give you 5 simple ways to do that. So number 1 is to empower the patients. After they see the physician, you can send them a link to a site that requires a little bit of love. So if you notice when you Google yourself later that you have a really low rating on Vitals, well then send everybody to Vitals. Don't give them a bunch of options, because patients kind of have that shiny ball syndrome, and they'll just kind of lose focus and look around and not do anything. So if you give them the one choice on one spot you want to focus on, we find that really works very well. And then obviously in the office, you can also post some signage, some flyers, and social media, and call for reviews and things like that. But that really works well once you kind of empower the patients to help you. Right there is an example of something that we do. This is a online newsletter that one of our clients sends out specifically every month to patients, just kind of letting me know about announcements and things like that going on with the practice. And right now we're focusing on Google for him. So there's very clear instructions and a big nice arrow that says exactly what you're looking for on that page to help. And there's an example of a flyer that you can create to put around the office, and just to kind of grow that social media following and reach. So number 2, use your testimonials. At some point there is either a written story somewhere that a patient has sent you, or you've got a video or something like that. And so what we do is we turn these into endorsements, and really that can help with not only your social and your reach, but it kind of helps soften how patients view your practice, because believe it or not, a lot of people don't like to go to the doctor. So what we do is a big part of what we do is trying to make sure that the first experience, it kind of gives that warm and fuzzy. So if you use a testimonial and that patient can watch a video or see a photo, or just read a couple of sentences, it says, well, this person was just like me, and they went to this guy and now they're better. And, that goes so long. And one of the great things about testimonials is that the content, you can use it in so many different ways. We're big advocates on actually doing videos with doctors. So what we'll do is we'll film a patient with a physician, and immediately we can turn that into a video. We can take a still of that and put that on social media and on the website. We can turn that into a blog post, and it's kind of the gift that keeps on giving. And what's great about this too is, obviously the patient is excited about it, and they'll go ahead and take that opportunity to share it with their friends and their family, and it really makes them a loyal follower for the practice. And when they're back in there and interacting with that doctor, it's also a great chance to ask them to go ahead and focus on that one site and say, hey, thanks for doing the video or giving us this testimonial. By the way, would you mind helping us out and leaving us a review? And we find that if we can get them to that point, it works almost 100% of the time. So tip number 4 is to find a champion within your patients. Odds are there's a patient somewhere. They got a crush on your practice. They love you guys. So they'll do pretty much anything you ask of them. We actually we have someone that kind of fell in love after her knee replacement with a client that we work with, and she literally comments on every single thing that we do, and it's kind of weird actually, but she likes everything. She comments on it. She has been to every single one of the review sites, and she's like copies and pastes a review about how great the practice is. And I mean, it's been great. And all we had to do was ask. So yeah, we let them kind of share the love across the internet, and odds are there's someone like that, that's a patient of your practice. So last tip is to have a physician make the ask. If you really want someone to go ahead and leave you a review on one of those sites that I mentioned. The doctor's the star of the show. Patients are going to listen to them more than they are, someone that's checking them out, or if they just see a sign in passing. And what you see on the screen right there, that's actually a little business card that we create and we hand out to some of our clients, and we'll say, hey, we train the doctor too. So if he knows that the patient is happy, he'll pull that out of his coat and say, we would appreciate if you'd leave us a review. And again, we find that probably about 7 out of 10 times, if the doctor's making that ask, it works really, really well. So what works and what doesn't? Those things I just talked about, those work. Really important too is training the staff on the type of patient that they should be looking for. You want to make sure that the patient is happy. And also, if you're going to do a video testimonial, if that's something that you're planning, you want someone who's well-spoken. They don't have to be beautiful, but they shouldn't live under a rock. Yeah, so you want to choose, like I said, one review site to focus on at a time, because, like I said, the shiny ball syndrome will it doesn't work out. So not creating too much work for you or your staff is key, because if you create too much work, well, who wants to do that? So if it's too hard, if it's too the point of entry is too difficult, then you're not going to convert. So we also find that proactively monitoring reviews works really well, obviously. And so what doesn't work? If you ignore those things that I just talked about. Sticking your head in the sand also does not work, because no matter what, these patients are out there and they're talking about your doctors and your practices, your locations, how clean the office is, if there's a boating and two-piece bikini involved. Someone, if that upsets someone enough, they'll talk about it, and they'll go online and they'll share it with their friends and family and complete strangers on Yelp. So it's important to know that this stuff's happening whether you are paying attention or not. Having a review kiosk or a tablet or something like that at your office does not work. You actually, depending on the rating site, but if it's coming from the same IP address, or basically if all the reviews come from the same computer, they will be deemed ineligible. So we've had that question quite a few times, so do not go that route. Obviously, you want to keep the signs and things to a minimum, because just like anywhere, if you walk into an office and there's 1,000 signs or so, I'm sure some of you have seen an office or two like that, you just kind of ignore all of them. Quick case study for you guys. This is actually a client of ours, Windermere Medical Center. They opened just a few months ago, and they had some pains as they were opening, and some of the patients went online and left them a negative review on Yelp. And so what we did was we came up with a strategy to reach out to patients and kind of make them online advocates for us. And so you can see there's one of the original posts from one of the irate patients. And what we did is we put some signs in the office and went after a couple of patients that we knew really loved the practice and the service that they received, and Dr. Patel and what he was doing there. So very quickly, we were able to turn this around for him. And if you look on the front page of Google there on the bottom link, you'll see that the Yelp rating is a 4.5 star with only 6 reviews. So it was very easy to swing the review in the right direction. And again, if you're a patient and you see that and you obviously see 4.5, that looks much better than 1.5. So mission accomplished there. So what to do before attempting to claim profiles. I asked you guys earlier how many of you had done that. There was just 3 or 4 hands or so. The profiles that we're talking about is vitals, health grades, you compare healthcare. There's about a dozen of them. We only focus on what's on the front page of Google, but a couple of quick tips for you is just to create an email account and a spreadsheet to keep all of those logins handy, because you will have a separate one sometimes for each practice or each website, and you know what information is required for each site. They require quite a few things to make sure that you are who you say you are and that you can actually claim those profiles that you're trying to claim, and develop a plan to respond to these negative reviews. We suggest having a canned response that you can kind of tweak for each review, or having 2 to 3 canned responses really that you can tweak for each review, and show the patients that you really care and you can get something out there timely. So to do that, we actually have a free ebook online at drmarketingtips.com/ORM. And that will show you how to claim your profile on some of the biggest sites out there, and all of the information that you need when you are ready to claim, so you can go ahead and get that done.
Elizabeth with Digestive and Liver Center of Florida. We have an office on Dean Road. We're very familiar with Corey. Corey, the question is, we do have, we monitor reviews. Well, I think the work that you do is very important, more than people realize, because everything is online now. We look it up even for ourselves before we even decide which group to go to, which doctor to go to. Some people don't have family members here to go word of mouth, and that's what they go by. But it could be a blessing or a curse, like you have said before. Nowadays, a patient may not even tell you, and that's the main problem, that there was an issue. They go online first. So you find out through online. And that's what happened with the billing issue we had with Yelp. But what I found is that even though we had people that said, you know what, I'm going to do a review for you on Yelp, and they've done reviews on Yelp, they're not showing. Mm-hmm. Okay, and when I contacted Yelp, I was told that it's because they're not avid Yelp users.
Correct.
So could you elaborate on that a little bit?
Yeah, so what they'll do is Yelp, they try and make sure that every review that is actually published and on the site is from like a trusted source. So what Yelp does is, if someone, let's say they went to your practice and they loved you guys, and so they created a profile on Yelp, reviewed you, and that's all they've ever done. Well, Yelp says that that is not a real person or an avid user, and so they don't trust that review, and it's still published, it's just hidden. Yeah, so no, and so the only way, unfortunately, to get that review to show up is to push that person to be more active on Yelp. Yelp has all the power, unfortunately. Yeah.
Okay.
Good morning. Hank Lander, Communication Solutions. I'm very familiar with the topic dealing with the front office staff and the like, and I'd like you to speak to a couple items. First off, putting words, the grammar usage, and some of these words, we've got to get our offices to stop and people to stop saying, no problem, they just have to say, I'll take care of that. Stop, because it shouldn't be a problem in the first place. So the no problem, no worries, we've got to get people back to English. But along those lines, I'd like you to talk about Spanish and English and how important it is to have people that are able to speak both languages in the office, and how does it affect on the internet as well? Because it shouldn't just be English on the websites for these reviews.
Basically, in Florida, we need to pay a lot of attention to that because there is many people like me that we are in the process of learning English, and we need someone to help us. And of course, some patients, they don't go just because they don't understand my problem. So we need to pay attention to that. On what is online, of course, we also want to have, we need to invite our Spanish-speaking people to also give us their testimonial, because other patients that are Hispanic are looking for someone that can help them in Spanish. So definitely they will find their way. It won't help you a lot on what is ranking because it's in Spanish and the algorithm is in English, but it will help you on the conversion of prospects to become new patients.
We've also had to be very creative as well. And not only do you have the language barriers as far as language, but you also have patients who are deaf and communicate through sign language. And so we've had to bring in companies that would be able to translate. Just the other day, we had a patient who only spoke Creole. We didn't have anyone in the office who spoke Creole. So we had to be creative because we did not prepare for this patient because we did not know beforehand that there was a language barrier. So we had to jump online and get a translator, and that was the way that we had to communicate with the patient. So sometimes when put in a spot, you have to be a little bit creative because you have that patient in front of you, and this was a matter that needed urgent attention. So we had to be able to communicate with him. We could not even get a family member or friend. This patient was here with no family members and didn't present with anyone who would be able to translate. So sometimes, whether it's a language barrier or sign language, you either need to get a company or be creative and jump online and use a tool that you have access to.
That's a great point. Everyone thinks of just either English or Spanish. I was at a presentation a few weeks ago, and the superintendent of Orange County Public Schools spoke, and she said there was 164 different languages in the Orange County Public School.
Certainly.
I was
Wow.
like, whoa,
Wow.
okay, I didn't think there was that many.
Have you thought about using your employees as another marketing tool, especially online?
Certainly. Well, that is something that we always, it's not a situation where, well, once a month we talk about customer service. It is an ongoing process, and it should be an ongoing process with any practice, whether it's medical practice or hospitality or any type of industry. Customer service, we all need to be customer service oriented, patient centered. And so it requires us to continuously, on an ongoing basis, to always try to perfect or adjust according to the situation. So like I said earlier, not just in bad situations do we take a situation as a learning experience, but also a good experience to also train and to instill and reiterate the reasons why we do the things that we do, because patients respond to that effectively.
Yeah, we find one of the things that works really well too is actually bringing the employees in on kind of the planning sessions and showing them the positives and the negatives, because if you think about it, I would say probably 80%, maybe even more, of a patient's time spent in the office is not with the doctor. You're dealing with everyone around the doctor. And so we see on review sites all the time that, oftentimes they'll say, oh, the doctor was great, but the front desk girl was terrible. And then they'll go on that rant. So then we'll take that and then we show that and say, positive or negative, and kind of use that as a teaching tool.
And I'll add on to that, because I always say that you have an office visit with that provider, that face-to-face interaction may be about 15, 20 minutes. But as a result of that, a 15 or 20-minute visit with the provider, you're talking about maybe about an hour and a half to 2 hours of patient care. When you think about that initial contact from the phone call to patient entry, to checking that patient in, getting the patient back, working the patient, doing the billing, all those key elements is a part of that 15, 20-minute encounter with the patient. So in our practice, the great thing is that we're a small enough practice that everyone has a voice. And so we're all a part of one team. There's no levels in the office. We're all a part of a team. And so we have patient coordinators, not front desk, back staff. We're all patient coordinators because we're all just as much as part of the practice is the doctor, because take everyone else, the doctor can't stand alone. He needs his staff around him. So we're all a part of the team, and we all work together as one.
So it's really about creating that in-office
Cohesiveness.
culture of this type of patients are important and all of
Certainly.
those sort of things. That's great.
Certainly.
And another question from Jeff?
Hello, Jeff Holt with PNC Bank Healthcare Business Banking. Question on services around that, because this all clicks with me out with all the different practices I visit, and that need some assistance. But have you heard of any services though for like shoppers that could come in and be like a patient that comes in and observes? Because I think it's better to get somebody from the outside looking in to really understand and see the things that are flaws and that need to be fixed. Are you aware of any type of services in this area that
Well, I
could be
know that
available to practices?
some practices may consult with a consultant to come in and do patient observations. I know Bernadette used to do that if she still does that. But consultants, you can get in contact with a consultant and they may come in. We don't particularly do that just because we do periodic surveys and patient feedback. The providers are really good about asking patients their feedback. So.
One more question, Dan?
But I want to invite everybody to go on our LinkedIn open discussion group to talk about this subject, so that I'm just going to pose a question to each, because I know, Corey, you mentioned at the MGMA yesterday that you're in offices all the time.
Mm-hmm.
I've probably called on thousands of medical or dental practices over my lifetime. But Michelle and Jorge, having been to both Candor Dental and Clayman Urology numerous times, more than 5 each, I enjoyed the experience there. So I want to just have each of you maybe just tell a story about which one, because I loved your story too, Michelle. Everybody talked about the comfort that someone would feel. And to me, sometimes you go into different zones within a medical practice. The lobby would be one, then you go to the front desk, and then you go in the back, and there's a circle that you go. And you want to have the consistency. So comfort, consistency, you need caring, you need competence, because that's what I look for sure. And then compliance, though, is something that I find abominable, those sort of discussions around patients that doesn't go. Could each of you just comment just briefly on what area do you think is the most negligent in some practices that you've either gone to or visited, or even the best practices that you've seen?
You know, to be honest with you, Dan, I don't want to. I think the toughest part in a practice sometimes has to be the front office, because they just have so many tasks and so much responsibility from checking in and checking out. So I think sometimes the staff can be overwhelmed, and I think sometimes that can be problematic. But just reinforcing and giving that support as much as possible. But I do think that the hardest task or department, if you want to departmentalize or separate them, would be the front staff, because they do have the very tough task of simultaneously checking in patients, speaking with patients. They have so many different modes of information coming in, whether it be by phone, and our phones are live, so that can be a headache sometimes. But the phones, patients, doctors giving orders, and so many different distractions that come into play.
Yeah, I would agree with that. I see in practices sometimes, it's great when they have a system and they've got one person answering the phone and they're kind of staggered, and then one person dealing with patients that are coming in and checking in, and they can kind of work together. But obviously that's not always the case, and they can get backed up, and like you said, there's nothing you can really do about that sometimes, just because that's the way that the office kind of works together. And another thing that I'll add to that is the way that the office is actually designed and laid out, which sounds kind of silly, but if you look at especially older offices where they have that that sliding glass window, or now that they've taken down the window but they're still separated, I think that creates a kind of a subconscious sense of separation between the patients and the staff when they're behind that wall, and all you can see is kind of their face. And a lot of newer offices now are very open and airy. And I think that adds to the whole experience from a patient standpoint too. So.
Okay, well, basically Candor has paying a lot of attention to that, and they have tried to be totally different to what a dental office is or what a spa is. So like Michelle and Corey just mentioned right now, they have tried to, from the beginning, once you come, once somebody calls, they have everything very prepared for you to receive the best top experience in the world. They want to be the best. That's what they're trying to do. And they're paying all the attention choose service. It's all service. Yeah.
Thank you so much, Jorge, Michelle, and Corey. This was great information.